Pedijatrija u fokusu. Pedijatrija u fokusu. U fokusu je zdrav.
Dobar dan i dobrodošli u još jednu epizodu podcasta Pedijatrija u fokusu. Danas sa nama imamo specijalnog gosta koji nam dolazi iz Istanbula, a to je profesor dr. Cengizom Canpolatom. On radi u Acıbadem u Istanbulu i danas će vas uputiti, to jest pričat ćemo o raku kod dece. Hello, Professor Doctor. Nice to meet you and thank you for coming. Today we are going to talk about cancer in children, symptoms and successful treatment. We are very glad to have you here, and let's start with the first one question.
Thank you so much. I am very glad to be here too. Thank you for having me. And I would like to answer all of your questions as much as I could.
Thank you so much. And we start with first question. What are the most common types of cancer in children?
The first one is leukemia. Of course, everywhere in the world, acute leukemias are more common than chronic leukemias, but almost 30% of all pediatric cancers are leukemias. And then comes central nervous system tumors and lymphoid tumors, and then adrenal gland tumors like neuroblastoma, and then Wilms tumor from the kidney, and then soft tissue sarcomas, bone tumors, hepatoblastoma from the liver, and all the other rare type of tumors.
Yes.
This is the order.
Yes. Are there early symptoms that parents should be aware of?
Yes, there are, especially in childhood leukemias. Since leukemia is a disease arising from the bone marrow of the child, and the bone marrow is the organ that all the cells are being produced. When leukemia cells infiltrate the bone marrow, the other cells, the normal cells, are being produced less. So there is less red blood cells, there is less platelets, which help to coagulate, and there is less white blood cells. The immune system is down, and the white blood cell count is down, and the child has fevers, intractable fevers that may not respond to any type of antibiotics. Then some, petechia and ecchymosis, which means there are tiny bleeding spots on the skin and big bleeding spots also on the skin. And then the child looks pale because there is less hemoglobin, less red blood cells, always feels tired, sleepy, and does not concentrate enough. So these are the most common symptoms. But also there are some enlargement of lymph nodes around the neck, or in the armpits, or in the groin, and enlargement of the liver and spleen, and also bone pains, extremity pains, most of which are confused with, growing pains.
Yeah.
The parents really do not pay any attention to it until it becomes obvious that the child is not able to walk.
Yeah.
So these are the most common symptoms of leukemia, but they may be confused with other normal diseases of the childhood. So because enlargement of lymph nodes or liver or spleen may occur in normal infections as well.
Yeah.
And when the platelets drop, for example, in ITP, not in leukemia, but in ITP, immune thrombocytopenic purpura, we can also see bleeding spots on the skin, but it's not leukemia, it's something else. And also liver and spleen and lymph nodes are also confused with viral infections.
Yes.
Like Epstein-Barr virus, cytomegalovirus infections.
Yes. How can parents differentiate between common childhood illness and potential signs of cancer?
If they see a mass in the abdomen, or they feel it when they wash the child, it means there's something abnormal going on there. Also, they should bring the child immediately to a doctor. If the lymph nodes are enlarged and do not respond to any type of antibiotics, appropriate antibiotics for suitable time, and they should bring the child to a doctor because the lymph nodes may be something else. And also fever. Fever does not respond. You do a lot of blood tests, but you can't find anything. You have to bring your child to a physician's attention immediately.
How common are malignant tumors in children compared to adults?
Oh, the children's cancer are completely different than adults, especially their cells of origin is different. In adults, we usually see, breast cancer, lung cancer, prostate cancer, and so on. But in children, we see leukemias, lymphoid tumors, neuroblastoma, kidney cancer, bone tumors, Wilms tumor, and so on. These are completely different type of tumors, and their treatment is also completely different.
Yeah.
Duration of the treatment is also completely different, and the drugs are also different.
Yeah.
Fortunately, childhood cancer is much less commonly seen than adult cancers, almost a couple of 100 times less, fortunately. But they are more curable than adult cancers.
What are the main risk factors for pediatric cancer?
As in adults, we do not see the effects of any sun rays, ultraviolet exposure. So it's not that. It's not smoking. It's not alcohol. It's not eating habits, or it's not inactivity. Those are completely different in pediatric age. We usually see cancers in children due to genetic disorders. Some mutations in the genes that might cause cancer. Some of the pediatric cancers, like 10 to 15% of pediatric cancers, are hereditary. So they come from the parents.
Yeah.
But that's a small minority. Otherwise, all type of pediatric cancers are purely genetic.
Now let's talk about diagnosis and detection. What are the first steps in diagnosing pediatric cancer at your Acıbadem hospital?
If we're talking about leukemias, the first thing we do is to admit the patient and then check the blood count and all the necessary other tests and stabilize the patient first in terms of, biochemically and coagulation, also bleeding and so on, everything. And then we take the child to the surgery. And then we do bone marrow aspiration and biopsy under general anesthesia. So the child does not feel any pain at all, and he has no memories of that procedure specifically. And then we send that bone marrow sample to necessary laboratories. We also do a lumbar puncture to see if the nervous system also is involved with the disease or not. If it is involved, it's a high-risk disease. For leukemia, the diagnostic procedures are like this. But for solid tumors or for brain tumors, we have to get some imaging studies.
Yes, radiology.
Like MRI, like CT, like PET-CT, and ultrasound, and all the other stuff. Diagnose the mass or the tumor over there. Then we ask the surgeon to do a biopsy from it or to remove it completely if it is possible. And then we send the sample to pathology and also to molecular pathology. And some cytogenetic studies are also being done from it. And when we get the data from all those laboratories, we put them together and we analyze them. We measure the stage of the disease, whether it is local or disseminated to other parts of the body. Because if it's disseminated, stage of the disease increases. And the treatment differs.
Yes.
There are different protocols with different drugs and different intensity of the drugs for pediatric cancers. Stage 1 diseases are being treated with less amount of chemotherapy, with less drugs, but stage 2, 3, 4 diseases are also treated with more drugs.
Different, yes.
Different drugs.
How long does the diagnostic process typically take, and what tests are involved?
For leukemias, we put the diagnosis to the patient as leukemia in about 24 to 36 hours.
Yeah.
Because when we aspirate the bone marrow, we send it to the flow cytometry laboratory, which detects the surface antigens of those cells, on those cells. So the surface antigens are typically from the leukemia cells or from other cells. It is obvious in 24 hours. When we establish the diagnosis as early as possible, and we start the treatment very early compared to other hospitals. And if we talk about imaging studies, when we admit the patient, it takes 24 hours to do an MRI or PET CT or everything, because all the machines are available. Of course, they are busy, but if the patient is a child, everything stops.
Yeah.
And the child gets the priority.
Yeah.
Because it's a human being, we have to diagnose it fast and treat him fast, because he or she has a whole lifespan in front of him. When you talk about adult patients, for example, 60 years old man, I mean, of course it is important. The life is always important.
Yeah.
For that patient also. But if you treat a child from cancer, then you give him a life.
Yeah.
So everything comes forward for pediatric patients.
Yeah.
So we diagnose them early. Surgery is always ready. Brain tumors are, operated on within 24 hours. And other surgical problems are also being taken care of in 24 hours. So, and the pathology. In some other centers, pathology takes a lot of time. But in Acıbadem, we always communicate with the laboratory, with the pathology. We force them.
Yes.
And they always know how we...
Fast diagnose. Yeah. Fast results.
We deal fast. Yeah, so they give us fast results.
Yeah. When is a biopsy necessary, and why is it important in confirming diagnosis?
Biopsy is always necessary because it's the name of the tumor.
Yeah.
It's the name. I mean, when you don't know the name, you cannot
name
who that person or who that tumor is. So, because every tumor has different type of treatment modalities. Only one or two occasions, the biopsy may not be necessary sometimes. For example, in brain stem tumors, like in the corpus of the brain, we used to not do biopsies because we did not have the facilities to further diagnose about the molecular pathology of that tumor in Acıbadem. But since 10 to 15 years, we aim at getting a biopsy from them. Although we know that they are always high grade and they are mostly non-responsive to chemotherapy, we get biopsy from them if we get the consent from the patients, of course, and then we send it to pathology and molecular pathology, and most of the time in that tumor, the pathology finds a mutation. If it's a targetable mutation, we can aim at it with smart medicine, smart drugs. Then we use those drugs to stop the growth of the tumor and sometimes shrink it. So it's important to get a biopsy. But if the parents do not agree, then we continue with the conventional chemotherapy. In Europe, in Wilms tumor, our colleagues usually diagnose the Wilms tumor from MRI or from CT. So they do not do biopsy first with the fear that the tumor capsule may rupture and the tumor cells may spill in the abdomen. They give chemotherapy up front and then they try to make the tumor smaller and then do a surgery. But in North America and in other countries, the surgery is done first or the biopsy is done first and then we continue with chemo. Only those situations we do not get a biopsy.
Okay.
Yeah.
How are genetic tests used in diagnosing pediatric malignancy?
Oh, genetic tests are, if pathology is the name of the tumor, genetic tests is the family. They are very important in many types of pediatric cancers, especially in brain tumors, central nervous system tumors, and also in lymphoid malignancies, in leukemias, lymphomas, soft tissue sarcomas as well. Because sometimes the pathology may tell you, they give you good results.
Yeah.
They may say that the tumor is a low-grade tumor, and it's not very aggressive, and so you can treat that patient very easily, they say. But sometimes the molecular diagnosis says the opposite.
Yeah.
In a very low-grade tumor, if you find an aggressive molecular pathology, you have to disregard what the pathologist says and continue with the high-grade treatment.
Yeah.
High-grade tumor treatment. So molecular pathology is very important, not only for the diagnosis of the tumor, and also for the treatment follow-up.
Yeah.
Because when you kill the tumor, you should kill all the cells along with the disappearance of that molecular abnormality that was present in the beginning. If you do not clear it, if you still see that molecular abnormality, and that means that your job is not finished.
Yeah.
So you have to do something else or continue with your treatment.
Yes, I understand. Now let's talk about treatment and therapies. What are the primary treatment for child cancer?
There are several modalities. First, surgery, then chemotherapy. And in most of the tumors, we use radiation oncology as well. And also some molecular therapies,
Immunotherapy.
cancer vaccines, cellular therapies, and so on. So immunotherapy, targeted treatment, vaccine administration, oncological treatments, they are all members of the team.
Yeah. How does pediatric cancer treatment differ from adult cancer treatment?
Nowadays, and also in our country, and especially in Acıbadem, the cure rate of pediatric cancers is around 80%. So it is good. When you see a patient with cancer, a kid with cancer, there's a chance that you will, give him his life back in 80% of the situation. But in adult cancers, that percentage is only 50%. So most of the time, we give chemotherapy or other treatment to children with a curative intent. But in adult cancers, their aim is only a protection, prevention, and sometimes prolongation of life. So that's the main difference. In terms of chemotherapy, the child is small and his body surface area is much less than an adult patient. But the percentage and the intensity of chemotherapy we give to a child is much higher than an adult patient. So if we use the doses that we use in children in an adult patient, the adult patient will suffer a lot.
Yeah.
So he will, succumb to bed, he will stay in the hospital, fevers, infections and so on. So children, since their bodies are being, proliferating and growing all the time, their cells are also growing. And since their cells are growing, they are less resistant to side effects of chemotherapy, and they get rid of them quicker than adult patients. And they get more treatment than adult patients. That's why they are being able to be treated more.
Or how is chemotherapy administered to children, and what are the most common side effects?
Chemotherapy is usually administered intravenous by an IV line, most of the time, in about 80-85% of the time, along with some, protective medicines. For example, we use some medicine for the hearing loss that might be caused by a pediatric chemotherapy or nephrotoxicity or bladder toxicity. We use some other medicines to protect the bladder or the kidney. Most of the time intravenous, but sometimes, as I told earlier, we use targeted medicine by mouth. So by mouth is a good way of doing it because it has less side effects, that the patient does not have to stay in the hospital. It is cheaper.
Yes, cheaper. Yes.
And it's sometimes in some type of tumors more effective.
Yeah.
And sometimes we give chemotherapy intra-arterial.
Yes.
In the artery, not into vein. And that occurs in retinal tumors, tumors of the eye, retinoblastoma. It happens under the observation and supervision of a pediatric ophthalmo-oncologist. So those are the ways of administration of treatment to pediatric patients.
Yeah. What role does surgery and radiotherapy play in pediatric cancer treatment?
Surgery plays a pivotal role in pediatric cancer treatment, especially in central nervous system. What we do first is to remove the tumor first, because as much as we have to remove all the tumor if possible, because at that time our treatment is more effective. Some other lymphoid type of cancers or leukemia, surgery is not very important. We give chemotherapy and we make the tumor go away. But other solid tumors like bone tumors, like hepatic tumors, like kidney tumors, like adrenal gland tumors, surgery plays a pivotal role. Because if you take out the tumor, there is less tumor cells that you can treat with other types of treatment like chemotherapy and radiation therapy. But if the tumor stays there, your job is more difficult.
Yeah. Acıbadem is known for advanced medical treatment. How does it incorporate innovative therapies like immunotherapies and targeted type for pediatric patients?
We have a very advanced technologies located in Acıbadem Health Group. They have a cellular therapy section in which all the necessary cancer cells are being studied in terms of immunotherapy. They produced CAR T cells with those cancer cells, and they, sensitize those cells outside the body, make an engineering on them, and, sensitize those cells against the patient's own immune system. And the immune system responds and kills those cells when those cells are, again, given in the body. And also, some tumor cells are removed from the patient, and dendritic type of cells from the patient's immune system are produced in the lab, and they are, given to the patient as a cancer vaccine. And when these dendritic cells are infused, they attack the cells, only those cells, not the other normal cells.
Normal cells.
And they kill those cells. But for doing that, you have to make a lot of, laboratory investigations, of course, like next generation sequencing, like molecular sequencing and everything. That's a very delicate type of work. And if you do it properly, and those are useful treatments. And if you want to use targeted treatment, you have to diagnose and, you have to pinpoint those abnormalities, those mutations in the cancer cells so that you can apply targeted treatment. It's a different technique and it's not available everywhere. And it's been, in use in our hospital since, more than 10 or 15 years. So we are lucky that we have the capacity of, doing all those new innovations. We bring them from the lab to the use of the patient in the clinic.
It's good. How can parents recognize emotional, psychological impact of cancer diagnostic of their child?
That's a very good question because treatment of cancer is not everything. Of course, it is very important, but you have to treat the parents and their psychological or emotional problems as well, along with the patient. When a patient comes to Acıbadem from another country, let's say, they are out of their comfort zone. Because when they are at home, they have family, they have friends, they have neighbors, they have all the social support they want. But when they come to our center, there are no social support like family, of course. But otherwise, Acıbadem provides them with good accommodation, comfortable place to stay, live for a while. Not only stay a few days in a hotel, but maybe live in that place for about a year or so, sometimes more than it.
Yeah.
So they should feel like at home. And they provide food, and they also provide transportation from that place to hospital and from hospital to their place of stay. So, and there is also a language problem, and that problem is also being solved by all different languages being spoken by many translators from different countries. So the only problem they have is probably their concerns about their child's treatment. But we provide information to them all of the time. When they are in the hospital every morning, how the child is going, how the child is doing, what is his blood counts, and what's the cause of fever, how is the tumor responding to chemotherapy, and all the other stuff. So I believe when I look in the eyes of our patients and their families, I feel that they are happy. They are happy. Yeah, but emotionally, of course, they lack something, but otherwise they are happy. And they provide psychological support also.
Support, yeah.
Yes, there is a psychotherapist and a psychiatrist visiting the patient when necessary, and there is also a pediatric specialty doing rounds with us every day, every morning at 7. At 7, she hears the complaints of the patients, and when we go down to the clinic and start our routine daily work, she goes back and talks to the patients and the families. She plays games with them. She tries to make the patients happy, easy with something with toys or something like that, or with activities like painting, drawing, so that they forget their disease, they forget what they are, suffering from.
What are the biggest challenge families face during treatment?
The biggest challenge is their sorrow if the cancer treatment does not work. We tell them, of course, frankly, this treatment is not working. and we have to use another treatment for your child, which may be less effective, but there is still a hope. That's the biggest challenge they have, I guess. And financial issues are always solved by the help of the administration. But the biggest challenge is the sorrow sometimes I see in their eyes when the kid is not responding to chemo. Sometimes it happens very seldom, but, cancer is not a 100% curable disease. I told you before that we can only cure 80% of all cases in the world. So sometimes it happens, and we feel very sorry for the child and for them too, but that's the only challenge, I guess. That's the only challenge, I guess.
What is life like for a child after a successful cancer treatment? Are there any long-term effects of the therapy?
Yes, they are. Cancer treatment has many side effects. There might be hearing problems because of cisplatin administration. Cisplatin is a medicine which is used in many pediatric cancers, mainly in brain tumors and liver tumors and so on. So we use protective medicine for that. So hearing problems, kidney problems, bone and muscular problems sometimes because of surgeries, some bone tumors, surgical problems, cognitive decline sometimes, cognitive problems, school performance decreases, IQ rate is decreased when the patient receives chemotherapy along with radiation to the brain for brain tumors. Most of the brain tumors are being radiated for treatment. Cognitive problems, secondary cancers.
Yeah.
It is also important when you give some medicine to your child for the treatment of his cancers. Those medicines can sometimes cause cancer in the future. So we have to follow them up in terms of heart problems, kidney problems, hearing problems, cognitive problems, endocrine problems, growth deficiencies, hormonal deficiencies, and all the other stuff. And when they become an adolescent or adult, if he or she had a surgery before and handicapped, we have to follow them for accommodation into the society.
Yeah.
For finding job, for, finding a mate, for marriage, and, we're raising children. Because marriage is another issue, because sometimes some drugs that we use in pediatric tumors may cause infertility. Infertility is another important issue, so we have to follow the sperm count and the ovum count of the patients, and if possible, if the child is at that age when she or he receives chemotherapy, we have to preserve those functions as much as we can by, obtaining sperms or obtaining eggs from the patients. That we do it also by the help of urology and gynecology.
Yeah. When we talk about the future of pediatric oncology, what are the last research in pediatric cancer treatment, and how does Acibadem contribute to this field?
As I have mentioned before, the laboratory work, research, and implementation of that research into clinical practice is very important, and that is being done in Acibadem very successfully. And there should be improvements of the radiation oncology, because when you give treatment, radiate to patients, some, healthy tissue around the tumor is also being radiated. But now we are in the process of obtaining a proton beam treatment in Acibadem. I think it will be located, I hope, in our hospital, because we are the centers for the brain tumors, and that technique is used mainly in brain tumors. when you give radiation with other treatments, the radiation goes in and comes out from the other side. But in proton, it goes in, and it's focused on the tumor and stays more inside the tumor without spreading to other areas, healthy areas around the tumor, and it kills the tumor. So proton beam is going to be the only proton treatment in Turkey, and probably the first one in many surrounding countries. So it's good. The cellular therapies are good. Developing new drugs for pediatric cancers is also a job being done in Acıbadem. So I think we are in good shape. We can treat almost all type of pediatric cancers in our center if they choose to come to us. We are there to help them all the time.
It's nice. Thank you so much for this conversation.
I thank you so much.
For you come to us.
Thank you for having me. It was a pleasure for me. It was a pleasure to know you all. And thank you for the team also.
Yeah.
Thank you to the team also who is, making this, recording come true.
Okay, thank you. Hvala i vama što ste gledali još jednu epizodu Pedijatrije u fokusu. Želim da vam se zahvalim što nas pratite, gledate i slušate. Neka ostane i tako nadalje. Čuvajte, volite vaše mališane. Ja želim da se zahvalim i našim sponsorima, a to je Salveo Farm, Forma Ideale, Community Media i Acıbadem klinika. Hvala na pažnji.